Well, hello everyone, and welcome to this webinar today. I'm talking about the secret to healthy, youthful, and glowing skin. This is Dr. Seamus here, and I am excited to unveil some information that I believe is the most root cause and upstream approach to really tackle skin issues at their core. And so we're going to be taking a look at how we can resolve conditions like eczema, psoriasis, rosacea, even vitiligo and acne, and some of these things that can really just plague people and cause so many different physical and emotional just trauma and hurt, okay? And so I recognize that sometimes people are dealing with skin issues for years and years, and that's part of my story as I'm going to address on the next slide. But I'm excited to unveil an approach that I think can start to be implemented today, and we can see results in as little as a day if we can implement some of these steps properly. So let's go ahead and jump in here. So here, I just want to start here with my story, and as you can see, this is a picture I found on Google of what is called a boil, okay? And sometimes you can have a collection of these even called carbuncle cysts, but it's an area where these different immune factors and immune cells called macrophages in the body can come to a site of tissue injury and start to wall off an infection so it doesn't go as more systemic and widespread in the body. And as a result, you can see all of these different kind of cardinal signs of inflammation like redness, swelling. I'm sure there's pain associated with this. There's heat. And so I have this picture up here because this is actually something I dealt with, and I got my first one of these when I was in 10th grade, and I remember it just popped up for me. It was behind my ear. Ended up going to my primary care physician, who ended up lancing it and prescribing an oral antibiotic as well as a cream-based antibiotic. And I was very thankful because the swelling started to come down immediately. I could go back into school the next day feeling more normal and everything. But unfortunately, it recurred about a week or two later. And so this time it was right on my forehead, a big old bump, and I had some much bigger than this even presented in the picture here. And I ended up having these. It was a cycle for 9 years, okay, where I just went from doctor to doctor and took so many different medications and antibiotics and tried to figure out what was going on, but never got any relief. And it's just persisted through high school, into college and grad school, and even into chiropractic practice after that. And it was something, that just took a tremendous emotional toll on me. I was skipping classes, didn't want to be seen in public, and, just started wondering, is this my plight? Like, is there hope for this? What's going to happen with my complexion? Can this get better? Is it going to resolve? And it was very hard to really conjure up just the courage to be in public and just the excitement of life and to go through with a positive mentality and outlook and everything. And so I was so blessed to be able to meet a couple different natural healthcare practitioners who started taking a look at my diet and really gut health and internally what was going on. And so we revamped my diet. We supplemented appropriately, took a look at different lifestyle factors to change. And, so blessed and so thankful to the Lord for healing and restoration. And I'm at a point today where things are much better cleared up. And I'm so grateful to the Lord for healing and for the direction to these different natural healthcare practitioners to aid me along and guide me with certain knowledge of what to eat and how to supplement. And so, I know the pain of what it is like to just have terrible skin issues, and so that's a lot of the motivation for this webinar, is to be able to present some information that I think can really allow liberation and help you guys out as well. And so we're going to jump through here and just take a look at a basic picture of overall skin anatomy, okay? And so we have here the layers of the skin, and we can see on the right here, we have just these 3 basic layers: the epidermis, the dermis, this vascular layer where the blood vessels are, and then the hypodermis, and also these 5 different layers on the left, getting a little bit more specific here. So just a general picture of what the skin looks like. And then we can take a look at a few different skin facts, okay? I just found these pretty fascinating. The skin is actually the largest organ of the body. And there are 11 miles on average in adult skin of blood vessels and vasculature, okay? So important for proper perfusion, bringing nutrients to the skin and getting nutrients transferring back and forth. Skin renews itself every 28 days, and there are actually 1,000 different species of bacteria on the skin. We also have at least 5 different receptors that respond to pain and touch, okay, allowing us to feel just thermal, like hot and cold, as well as different sensations of the skin as well, at least 5 different receptors there. Okay, and so in response to the subtitle, again, where we're taking a look at that most root cause approach to addressing skin health, this is really what it boils down to here. And this is a picture of leaky gut syndrome, okay? And if we look on the left side of this picture, we have a normal tight junction. And if you think, this is the intestinal environment right here. And we have these cells here, and then between, there's what are called these tight junctions, which help prevent pathogens in the gut from getting through, because if they get through, they can get right into the bloodstream here. And we know that at that point, it can go systemic body-wide in everywhere in the body can travel at that point. And so we want these tight junctions in place, but when we have a situation called leaky gut or intestinal permeability, we have a situation where these tight junctions are not so tight anymore. And you can see that there are direct passageways from the inside of the gut here through the wall and into the bloodstream, okay? And now there's these different pathogens, maybe food-based protein pathogens or antigens or different microorganisms or metabolic byproducts. They can slip through, get into the bloodstream and start to wreak havoc elsewhere in the body, okay? If they go and lodge themselves in the brain and across the blood-brain barrier, we can see things like migraines and headaches and even more severe neurological abnormalities. There can be issues with the thyroid if they inflict damage and inflammation there. But, you know, obviously in this webinar, we're talking about skin. So we can see things start to manifest like all these different skin issues with patchiness and scaliness and inflammation of the skin, and that is in direct response to leaky gut syndrome. Okay, so I'm going to be talking about some of the most egregious foods for the gut, and I like to break down these really 4 different categories, as we can see here. Gluten-containing grains is number 1. And why this is on the list is that there's been a hybridization of grains in recent years to where there's one wheat species conjoined with another wheat species, and it can create a different genetic sequence that our bodies can't metabolize and break down well. And so there's actually so much more gluten content in things like wheat, barley, and rye these days that can really inflict a lot of damage to the gut. And specifically in the presence of gluten in the body, there's this zonulin protein that is released that directly opens up the tight junctions and allows for permeability to take place, okay, and that these different pathogens can leak through, get into the bloodstream, and start to cause systemic damage. When it comes to conventional dairy products, we know that with cow-based dairy, there is an A1 beta casein, okay, that is very highly inflammatory. Oftentimes, too, the cows are treated with a recombinant bovine somatotropin, so a growth hormone, as well as directly injected with antibiotics, or it's in their feed. And then we get those antibiotics as well as we consume any kind of cow product, maybe that's not grass-fed or that's conventional dairy, okay? So that's a lot of the problem. That can cause a lot of dampness in the internal environment in the gut, and this can be a breeding ground for candida and yeast and bad pathogenic bacteria to proliferate as well. And then we have things like hydrogenated oils, okay? So many of the vegetable oils like soybean oil, sunflower, safflower, canola, corn oil, cottonseed oil are very highly inflammatory, have these high omega-6 content too, and sometimes they can just come from GMO, like rape seeds, GMO rape seeds, creating the canola oil, and these can just be very highly inflammatory. We want to focus on things more like coconut oil, extra virgin olive oil, avocado oil. These are going to be better options to cook with and to use instead of the very highly inflammatory hydrogenated vegetable oils. And then in addition to that, we have refined sugar and sugar alternatives. And you know, sugar is just a known toxin and can directly feed yeast and candida and can cause a condition called candidiasis. This can further exacerbate leaky gut as candida can perforate the intestinal wall. Okay, and sugar alternatives as well, do you know, favor saccharin, sucralose. They can be very neurodisruptive as well and very neurotoxic. So we want to stay away from a lot of the refined sugars, as those can just create more of a dysbiosis situation in the gut where there's an improper ratio of the good to bad microbes, okay, in the gut environment. So we're going to go to this next slide here. Okay, we're talking about other gut disruptors. In addition to just the food, there are other things that factor in as well. And we know that stress is just a known toxin, a potent carcinogen, can directly negatively influence the integrity of the gut lining. Is high cortisol, being in a sympathetic dominant state, can just pose terrible issues for the gut, again, with the integrity of the colon wall specifically. Lack of sleep factors in here as well. You know, we should be striving for about 7 to 9 hours of sleep per night, to where, you know, we're ideally not getting up through the night even to go to the bathroom. So I'd say try to limit fluid consumption right before bed, as well as blue light exposure can disrupt certain circadian rhythms. And so it's good to power down some of the electronics about an hour before bed, or use those blue light limiting glasses can be helpful as well. Trying to just have a routine when you go to bed. The body likes routine, and if we can adhere to that, you know, maybe going to bed at 10:30 every night, and the body appreciates that normalcy there. And so lack of sleep is so important. It's where a lot of just the healing mechanisms and the rejuvenation processes take place. And so that's going to be important to make sure we get proper sleep. A couple different emotions and different feelings of bitterness and unforgiveness actually can really harbor a lot of toxins in the body. And when the mind is not at ease, that can directly affect the gut health and the rest of the body health. Blood pressure elevates, and there can be a lot of issues when it comes to physical health manifestations. So we need to do our best to really practice gratitude and forgiveness, and just being able to cultivate a mindset of positivity and hope and faith-filled thoughts. We also see things like NSAIDs and antibiotics, okay, and these really don't discriminate. So antibiotics can kill a lot of the bad and the good bacteria too, so it can really disrupt the proper balance. And, you know, oftentimes people can be left more immunocompromised unless they're supplementing properly and getting proper probiotic foods in their diet. So we need to be aware of that. And then different food additives as well, especially food colorings and dyes and preservatives, can be very harmful. Pesticides and herbicides like glyphosate, okay, GMOs and alcohol, all these can be other gut disruptors, which can then fuel more of that leaky gut syndrome and be problematic, again, when it comes to overall skin health. So let's go on here. All right, so we'll talk about different healing foods now, and this is just a little short list here. We'll start with bone broth. This is usually at the top of my list for a number of different reasons, okay? I love bone broth for the fact that it has different amino acids, proline, glycine, glutamine. These can enhance immune system optimization as well as sealing up the gut, especially because it has collagen in it. And we need to remember, much of the gut lining is composed of collagen. It's going to directly reinforce that to help stave off that leaky gut issue. There are also there's glucosamine in here and different glycosaminoglycans like chondroitin sulfate, hyaluronic acid. There's so many beneficial nutrients to help really achieve overall gut health and gut wall integrity. Steamed and cooked veggies, obviously, we know we need to be getting more veggies, but, you know, I'll say too, a lot of times with raw veggies, they can be beneficial, but they can be hard on digestion. So I would see if you can steam more so than consuming them raw. That's also going to limit a lot of the bloating effect you could notice. And then easy to digest fruit, things like pears and blueberries, for instance. But, you know, a handful of berries can be a great option. Easy to digest fruit. Clean and lean proteins, so things like wild-caught salmon, organic turkey and chicken, grass-fed beef. These are going to be great options when it comes to the protein department. And then healthy fats. I'm a huge fan of healthy fats. Okay, so things like coconut oil, coconut products, avocados, chia seeds and flax seeds, walnuts and almonds. Okay, these are great sources of fatty acids, even ghee, clarified butter is a great option too. And these are going to help reinforce proper endocrine health. It's great for overall brain and memory recall and healthy for the nerves, as well as for overall gut health, okay? So we need to be focusing on healthy fats as well. These are some of the top healing foods I think we need to incorporate into the diet more. Let's talk about, let's see, some supplements here. Okay, just a couple I wanted to mention. Again, a high quality probiotic is going to be great. Even things like soil-based organisms and Bacillus subtilis is a great one. And then Lactobacillus plantarum, Saccharomyces boulardii, and the different high quality strains of probiotics, again, are going to colonize the colon with beneficial bacteria and help crowd out those negative bad species that can inflict damage. And then again, a good collagen supplement. And I like Ancient Nutrition as a brand. I think they're a very reputable quality brand. You saw that with the bone broth, was an Ancient Nutrition bone broth protein. And here's their collagen protein. I take them both and I found great results with them both. And again, collagen is going to help really reinforce the colon wall and create stability and strength there with the tight junctions in place, okay? Essential oils can factor in too here. And what I like to do with these is use them topically, okay? And so you can mix them with many different things, even a Manuka honey, some coconut oil, apple cider vinegar, and different toners or different moisturizer recipes. But these are some of the top ones for skin health. And frankincense, which is known as the king of essential oils, so many different benefits, very versatile, as well as lavender, myrrh, tea tree. And again, good to dilute with a carrier oil like jojoba, coconut, or olive oil. Okay, we don't want to flare things up on their own. They're very potent, okay, on their own. If you just apply them directly, you can get redness and burning. And so we want to dilute them appropriately, but they can be great for staving off bacteria from growing on the skin. And this can be a great kind of outside-in approach to really do a topical and really cover all the ground, in addition to implementing some of those dietary protocols as well. So these are some of the top essential oils I would recommend incorporating into a skincare regimen that can really take that to the next level. So really, when it comes to just the bottom line of this, what's going on in the gut is manifested outside the gut, okay? And really, I like this kind of quote that the skin is a window into the gut. And so what you're seeing being manifested on the skin is really allowing us to figure out, well, there is something going on that's wrong in the gut. And so that's why I like this outside-in approach, is that we need to figure out what actually is going on in the gut specifically. Is there dysbiosis? Is there SIBO? Do we have irritable bowel syndrome with constipation, diarrhea? Is there too much candida building up? Is there a problem with the ileocecal valve? If we can discern all these different things, we can really target the skin health properly. And so that's why I like to get some lab work, okay, on a lot of patients. And I'll kind of show you one particular test that can be very beneficial. This is called the GIFX Comprehensive Profile. And patients I see through Health Consulting Online, this is one that we order quite often because it's so incredibly insightful as to what's going on. And this is just one snapshot of what it shows on the first page 1 of 11, actually. It's very thorough from one stool sample even. And so it shows different things like maldigestion, inflammation, dysbiosis, metabolic imbalances, as well as infections, okay? And you can see these different biomarkers, what it shows for perhaps parasitic infections, bacteria and yeast that are present, if there's occult blood in the stool, okay? And also these different therapeutic options can be great. Maybe we need to buff up some dietary fiber, some probiotics and fermented foods, herbal antibiotics. And so again, this is just one page of an 11-page profile. And so this is incredibly insightful and gives me so much guidance working with patients to figure out, hey, what's going on internally? How can we more specifically and thoroughly really target and create a treatment plan that is based specific to the patient from their lab work? And so if that's something you guys are interested, I just direct you to this website right here, which can show you more about a gut reboot program I do and how we can really set things straight in the gastrointestinal environment and get out any kind of stealth infections, any pathogens, reverse any kind of dysbiosis, And I like to work with that through modifying the diet and really supplementing appropriately specific to the patient based on what we are seeing from health history intake form as well as from lab work. All right. And so in addition to that, I am here for you guys as an open reference. If you ever want to just run any kind of health concerns by me, you can find my email at drshamus.com. It's immunahealth@drshamus.com. Phone number 586-747-6788. Feel free to reach out to me. I also do 30-minute complimentary calls where we can jump on a Zoom session like this. Okay, again, free of charge, just to talk and discuss what may be going on, what kind of questions you may have. But guys, thank you for your time today. Thank you for being present. I hope you found some value of this in this. And again, these are things you can start implementing today to really start seeing pretty amazing results and changes in your skin health, even overnight. Okay, again, so we want to make sure we're staying away from a lot of the gluten-containing grains, the conventional dairy products, hydrogenated oils, refined sugars and sugar alternatives, and focusing on more of that healing diet with the bone broth, the collagen, the fermented foods, and the probiotics. And these are going to be pretty amazing protocols. Again, getting the bitterness out of there too, and the unforgiveness, and working on some of the gratitude in the mental department there. And so again, when it comes to skin health, we know that the skin is a window into what's going on in the gut. And so we really need to target things there, get things in order. And so that was really the secret I wanted to share in this webinar, is that if we want to really optimize overall skin health, complexion, or just anywhere on the skin, we need to make sure things are getting straightened out in the gut first. And then that has just an amazing impact on everything else, not only skin-wise, but again, things, migraines clearing up, thyroid issues resolving, hormones balancing out, inflammation in the joints being kept at bay. It's pretty amazing what can happen when you can look to the gut and get things sorted out there. And again, if you have any more questions or want to reach out, I'm an open resource to you guys. So thank you again for your time today. Hope you guys found this beneficial in some capacity and can start implementing some of these steps to see your skin health go to the next level. So guys, thank you again. Hope you all have a great day, and I'll see you soon in another webinar.